I'm really proud of the work that our Center for Global Health is doing. I'm proud of the 5-year memorandum of understanding that we have signed with the Ministry of Health, because it shows the dedication and commitment that we are making to this relationship. This is not a passing deal. This is really an immersion, a partnership, a collaboration, and one that will bring mutual benefit.
Welcome to 20-Minute Health Talk. I'm your host, Rob Hoyle. This week, Northwell Center for Global Health sent team members to Guyana, where they will offer a variety of services, address disparities, and develop a plan to support the more remote areas of the South American country. This is Northwell's second trip in 4 months. Among those who made the 2,500-mile journey on February 28th is Danielle Leon, who joins us from the Georgetown Public Hospital Corporation, located in Guyana's capital city. Later in the show, you'll hear from Launette Woolforde, Chief Nursing Officer for Northwell Health's Western Region, and another member of the Center for Global Health. But first, we bring you our interview with Danielle Leon. Danielle, tell us about your experience so far and what you hope to achieve.
This is a beautiful opportunity. Thank you for that intro. It's a pleasure to be here. My name is Daniel Leon. I am the project manager for the Center for Global Health. This is my third global health initiative. This would be a follow-up to our initial trip where we came down to, do a needs assessment of psychiatry and nursing. Those were the focuses. We came with about 8 specialties, pathology, obgyn, and surgery included. And this time around, it's a little bit smaller. We're with family medicine and pediatrics. This time, we really want to put our focus on EMS. You can help the hospitals. You can create a plan and try to fix the infrastructure. But a part of fixing the infrastructure is paying attention to departments like EMS, because we can fix the hospital, but if we can't get people there on time, we have another problem on our hands. Being somewhere like Guyana, which has such a vast terrain. And, it's not like hopping on the I-95 and going from, from the Bronx
Sure.
to Brooklyn or Queens. You're actually, you're going from grassland to woodland to, so many different terrains and passing through water. Like, I just learned about it now that we got to figure out a way to get, people to the hospital through boats, because one of the things that we got a chance to see was a floating bridge that actually goes up for like 6 or 7 hours a day, which makes it harder for EMS to get patients into, Georgetown Public Hospital. So these are things that we're taking into consideration. It's not just one thing. It isn't a one fix for everything. It's basically an assessment of every little piece of the hospital, from the grass outside to the floors inside. That's what it's been like.
Yeah. You're talking about education, and this is the first time we're sending medical students who will round through Georgetown Public Hospital Corporation. How important is it for those medical students to get a taste of this and see how other people live and how other people, lives are affected by their climate and other things?
Super important. I mean, I'd say this. You spoke with Launette Woolforde, or you're going to speak with Launette Woolforde soon. And there's another doctor, head of surgery, named Dr. Sugiyama. I'm meeting these people who come from different countries already. Dr. Sugiyama comes from Japan. Launette Woolforde is from Guyana. These are people who went to the United States, got an education, something to take back with them. She comes back, Launette. I'm here hanging with Launette. Launette's like a superhero to me, because my family grew up in the hospital. My father was an AR clerk, and just retired vice president of 1199. Both of my parents are activists. I've dealt with global health and disparities in healthcare, more specifically since I was a kid. I used to march with my dad, and now I'm here. So the hospital, for me, those are my heroes. The surgeons, the nurses, the doctors. Those are people that I've looked up to since I was a kid. And now I'm here in a country, right, where Launette Woolforde comes here with a plan. She came with didactics. She came with a real want to get to the bottom of it. That's deeper than something you saw on TV and you just want to get involved with. Her family's here. What's funny is that I got most of this from my father. I used to joke with him all the time. I used to say, look, I'm gonna be at the top of business. he was at the top of healthcare, and we used to go all across the nation, all across the U.S., fighting for healthcare workers that otherwise wouldn't have a voice. And I used to joke with him. I would be like, man, I'm getting a degree in business. I graduated with my MBA only to become the project manager for the Center for Global Health and do what my father did on a world stage. You couldn't write poetry better than that. It really feels good. It attacks the soul.
It's great to see your passion. In November 2021, the Center for Global Health went to Guyana with 17 health professionals covering 6 different service lines. This led to a 5-year medical partnership between the center and Guyana. Tell us about that agreement and what are the needs and how are you meeting those needs?
Well, that's the beauty of it. We're figuring it out together, right? Something that, my mentor, Dr. Eric cioe-pena, loves to say all the time is we're building the plane as we fly, which is so beautiful because if you think about it, really you don't know what you don't know, right? Everything is a process. We're trying to build it, but we're building it together, right? This is something that right now it seems like hard work, but this is laying down the groundwork of what it's going to look like for the next 20 years. The next 30, 40, 50 years, the next decade, next century. And that's basically what, my role has been in it, has been to basically cultivate a way in which we can have residents, fellows, and attendings flow into Guyana and flow outward into the United States and do an exchange of competencies and professions and create that pathway. So we're working right now on finding a way to have rotations in multiple specialties. There's always more to learn. I feel like I'm in school. I feel like a kid in class, and I love to learn. So, and they give me an opportunity to be wrong when I'm wrong and be right when I'm right and figure it out together because it's a learning process for all of us.
That's so awesome. That's so awesome. So what are the different service lines represented this time? I understand there's a focus on mental health. What can you tell us about that?
Well, mental health, man, was one of the biggest things for us and one of the biggest projects that I was able to be a part of. It's something that hits home. My brother passed away. He dealt with mental health his whole life. So it's a deeper calling for me, right? For me to be able to do a needs assessment of a psychiatric ward, I felt it. This is definitely something that is one of the most, one of the areas that Guyana really, really needed the most. And it just feels great that I have a bunch of health professionals that are at the top of their game that care just as much as we do.
That's awesome. You're in Guyana, Ecuador, India, as well as Dominican Republic, Kenya, and Uganda, just some of the countries that we're helping. How can listeners support the important work the Center for Global Health is doing?
You can definitely follow us on Instagram. We're always uploading to Instagram. We're always finding cool ways to interact with our followers at Northwell Global. You can follow us on Twitter, Instagram, Facebook. Look for us, Northwell Global, and also sign up for our CGH Corps. We're always looking for volunteers and people to help us in our global endeavors and initiatives. So you can find that at bit.ly/NWCGH. Again, that's bit.ly/NWCGH.
Well, we really appreciate the great work that you're doing there in Guyana and what you're going to bring home. I know you have a lot of work to do, and 2 weeks will go fast, so get out there and make us proud.
Global health never sleeps, my friend. I'm excited. Thank you so much for the chance to sit down with you guys. I appreciate it.
Joining us from Lenox Hill Hospital in Manhattan, Launette Woolforde is an internationally renowned expert in nursing and healthcare. She is a highly sought-after speaker and presenter and has been the principal investigator in an array of studies, primarily focused on nursing leadership, education, and collaboration. Earlier on the show, we spoke with Danielle Leon, who is now in Guyana. You visited Guyana in November. Tell us about your trip.
Well, thank you for having me. First and foremost, it was a great trip in November. One of the key goals of that trip was to bring to fruition the work that we've been doing for the past 2 years over the course of the peaks of COVID surges and across the pandemic, we've been working nursing in collaboration with Georgetown Public Hospital Corporation nursing leadership to identify where our opportunities were for collaboration, to build and strengthen capacity for nursing performance at GPHC, and using that to develop a blueprint that we would spread across the country. So our trip in November was designed to give us the in-person time that we so desperately looked forward to kick off, which we did with our nursing leadership retreat, explaining to the nurses and the leadership team across GPHC what this collaboration and vision was going to look like, to work with the CEO, to meet with the Ministry of Health. It was such a productive time and enjoyable time, I should add. And we all felt the joys of coming together and bringing to life the work that had been going on for the past 2 years.
That's awesome. Obviously, we know how it's helpful for the people in Guyana. How is it helpful for our staff that are going, and especially the medical students?
Yeah, well, on that trip in November, there were 17 team members from Northwell representing a variety of disciplines. And I think the big advantage for our team is exposure. Right? Healthcare here at Northwell and in our metropolitan area, while we certainly have room for improvement, it's quite a familiar kind of setup. And what our medical students don't always see, even nursing students, et cetera, don't always see, is what medical care and healthcare is like in other countries that may be lower resourced and therefore more efficient and more strategic at how healthcare is managed and delivered. The primary care system in Guyana is incredible. And that is an important structure that we are trying to improve in the United States and right here at Northwell. So looking at how they operationalize primary care to meet the needs of that population, the medical team, the nursing team, the pathology team, we had behavioral health team, we had a number of representatives on that trip. All were able to take away lots of lessons about how we can improve. And, when we met with the Minister of Health in November, he also very generously offered to partner with us to help our professionals learn about tropical medicine. And the many aspects of tropical medicine that we are unfamiliar with, which is this is an area of interest for a lot of our future medicine and nursing professionals. In fact, I got involved with the Center for Global Health before it became a formal establishment in 2019. And it's interesting because nurses would always come to me over the years and say, who do I talk to at Northwell to help me get resources for a humanitarian effort or a mission that I'm going on in a month or 2 months or so forth? And we really didn't have a solid answer for that. And so it was catch as you can, whoever you could ask, about equipment or supplies. And so this was a conversation that was growing in nursing. And with the establishment of the Center for Global Health, it really became home for the answers for all of these kinds of services and the desire that we have among our staff here at Northwell who really want to help, want to contribute to public health, and want to contribute to global health.
Yeah, that's awesome. New York is home to more Guyanese Americans than anywhere else in the U.S. There's a place in Queens called Little Guyana. And just tell me, that's got to be so meaningful for the people who are on these trips to come home and to be able to relate with these patients when they're here. It's got to really make a huge difference and make those patients feel comfortable. They have something to talk about now.
Absolutely. And believe you me, they are talking about it. We were saying when we were in Guyana in November that before the news had even hit the U.S. media, the Guyanese media in the U.S. was already speaking about this Northwell partnership. So the news had spread very quickly, and it's good news. And yes, it's our mission here at Northwell to serve our communities. And in serving the communities, you have to understand who are the members of these communities, what is their culture, what are their interests, and what's influencing their health, right? You can't provide the same recommendations or the same approaches for different people. You have to understand and meet them where they are. And the Guyanese community in New York, in the Richmond Hill area, I have a lot of family and friends in that area as well. It's a very robust Guyanese community. I don't know that everybody knows that. So this might be new knowledge for some of the listeners, but it has been a growing community over decades. And it is important to the Guyanese community, to our workforce, many of whom are Guyanese or of Guyanese heritage, to have that relationship, that kind of concordance between provider and patient improves health outcomes. It does. And so to the extent that we're able to bridge that, we are doing the right thing for the communities that we're serving.
Yeah, that's awesome. And what I think is really great too is that medical students are taking part in it. How valuable is that experience for medical students who are starting their careers to be able to have, this type of experience?
Well, I think it's priceless. And again, because these aren't, you can read about this in your textbook, what global health looks like, or how to establish good provider-patient relationships, et cetera. But no textbook can really provide the experience that the lived experience provides. And so what our medical students are gaining and going to continue to gain from this partnership is tremendous. It is noteworthy that although we had been working in nursing for 2 years solidly on this partnership between Northwell and the Center for Georgetown Public Hospital Corporation, there have been other endeavors that were already underway, including a radiology relationship with Guyana and Northwell Health to provide experiences for radiology residents to come from Guyana and partner with residents here at Northwell to again, learn and share. That exposure is really valuable, and it influences the way you practice. And that's the piece. A lot of the time for medical, nursing, and other professionals, they'll often tell you about some aha moment some point in their career where they had some exposure that really changed the way they practice medicine or practice, whatever aspect of healthcare. And what we are doing by establishing this relationship is bringing that aha moment to fruition earlier. You don't have to practice for 20 or 30 years to now have that enlightened experience that, wow, the more I know about my patients and communities, the better I can actually serve them. So I'm really proud of the work that our Center for Global Health is doing. I'm proud of the 5-year memorandum of understanding that we have signed with the Ministry of Health, because it shows the dedication and commitment that we are making to this relationship. This is not a passing, fly-by-night deal. This is really an immersion, a partnership, a collaboration, and one that will bring mutual benefit.
It's so amazing. And you mentioned positive outcomes. We always like to end on 20-minute health talk on a positive note. So what gives you hope going forward regarding Northwell Center for Global Health Initiatives?
Well, I think the passion of the Center for Global Health Director, Dr. Eric cioe-pena, and other members of the team. I really have to tip my hat to this group. This is a group of compassionate, caring professionals who have one thing in mind, and that is, how can we contribute and partner to improve the health of Guyanese in Guyana, and understanding, right, that the health of Guyanese in Guyana has a direct relationship to the health of Guyanese in America, and particularly here in New York, which is a large part of our community. And so it is so heartwarming to see their motivation, which is completely selfless. It is everything that you want in a practitioner and a provider, just people who want to see you succeed, manage your health, have great health outcomes. And so that passion is just, it motivates me every day. It's the reason why in the course of the very busy work that we all do, because I think it is noteworthy to mention that many members of the Center for Global Health team are doing other things on a regular basis, such as practicing medicine or a chief nursing officer, for a region in the health system. But because we so desire to see the success of these outcomes, and because we really do care about the purpose and the mission, we make the time, we make the space, and we collaborate with any and everyone to get everyone on board with the achievement of these goals. So it's just a great direction for Northwell and a great direction for our team members and for the communities we serve.
Launette and Daniel, thank you so much for the important work you're doing and for joining us here on 20-Minute Health Talk. And to you, the listener, thank you so much for tuning in. Have a great week and stay safe.